What are some takeaways from the pediatric OCD study, famously known as the POD study? The one thing, a couple of things that this study showed is that the combination of cognitive behavioral therapy and the medication are most effective in treating the obsessive compulsive symptoms. The second thing is that if the child Yale Brown obsessive compulsive disorder scale, which is called CY box, is more than 23, and our symptoms are more severe, then always try to begin with the combination therapy because it will have the better outcome. And what are different factors that are associated with the good prognostic factors when we are treating with the OCD? So if there are lower OCD symptoms, if the severity of functioning is not impaired, if the insight is better, and if there are less or minimal externalizing behavior, and there are lower family accommodations. And what are some factors that are associated with the reduced response? So if there are co-occurring tics disorder, or if there is a family history of OCD.